So, no, can't hear me?
No, you're fine. It's recording. I think you can just cancel it.
We're good, honey.
Oh, okay. So we're good. Okay. I'm not used to do this thing virtually. You know that. So, hi, welcome to our updates for the 10th day of August. And yes, believe it or not, too many things had changed between the last two on the last 2 weeks, like since the last time that we met. That was actually July 27th. So I usually, for giving the updates, I will keep, for new people that don't know how we do this thing, we keep the last thing that we said and update what happened in between these 2 weeks. So, well, here we go. Let me see. Oops, I need to click on this one. So, where were we a couple of weeks ago? And this is the last thing that we presented on around May, was when we had really low cases. You could see here it's more or less it was an average of 250, 300 cases per week. And we had like a nice 8 to 10 weeks on that level. And around July 11, we actually began seeing a real trend on cases increasing, because when just 1 week goes up, it's kind of not a trend. But now we have, from that time, we have 3 weeks going up, so we knew that this thing was kind of going up again. So where are we now? Oh, you can find this graph in that website. It's our website for coronavirus. So if you want to monitor in the week in between, you can go to that website. So we're this last week was week 31st. And this is where we were. And you can see this trend that is really, really going up. This was July 4th to July 10th. And this is where we were at the beginning of August. So we are now in week 32, epidemiological week 32. And the reason why I always insisted on maintaining it as a week, epi week, it's because of this. You can see in the green line how we were last year at the same week. And that's the way that we compare. So last year we had our peak after July 4th, and then we were going down. But this year we're really going up at the same period. So I know, because we're talking with teachers, what about school only cases? So these are the cases that are only from case from less than 12 years old. And again, here is the epi weeks. So this was summer. This was the end of past year, where we went declining in cases for 12 and younger. And this is where we began the school year, and we were going up. And this is actually from today. So you have here week 31st, how we're going during this week. So please remember that there is no vaccine available for under 12 years old. And that's important, because all these cases cannot be protected with vaccines. Now, this is what happened in school years 19 and younger. So you see the red are the 12 years old, 0 to 12, and the 13 to 19 are in blue. So all those blue cases, if they would have been vaccinated, maybe we will see a fourth or a fifth of what we're seeing now here. But that's the reality of schools. And again, this was the end up to week 10, was the school going out of classes, then summer, and then we began school again. Each school begins in a different time, but considering July, we're going up. We made a change of the Pinal County dashboard information, and the most important thing is we did this because of for the schools. So we want you to be able to know what happened from July 1st, 2021, and have a easier way to compare, because the cumulative data in epidemiology will show you things from 2020. And we really want you to know what is happening now at this moment. So things have changed. The first thing that changed, you can see, is since July 1st, 2021. The second thing that you can see is that because we're showing that, you can see that the cases are going up in Pinal County in this area. So we thought, because we have a meeting and I discussed with Joel and Daniel, if this maybe, we think that it will be better for you to see it in this way. And the other thing that you can see is that the cases by age group has completely changed compared with last year, when we had a higher number in 55 to 64 and over 65. Those cases were the typical demographic from last year. This year, we are seeing more cases in the 0 to 12, and mainly the 20 to 44. So that's for you to know. Also here, the cases by school districts are from the beginning of July. So you will see the darker the color, the higher the number of cases in your school district. And here you have who is actually having the highest number. And here you have each number per school district. So you're going to be able to see how many cases are in the school districts. These cases are actually geocoded by the addresses, because the school districts, you will know better than us that they are not corresponding with the address or the zip code. Sorry, with the zip code. Sometimes you have half of a zip code or a quarter of a zip code. So this is actually showing whoever is in your school district. The Union High School districts are only 2, and they are also represented there. And the transmission rates, and this is as yesterday, Monday the 9th, will be in that tab. You see here, there is a tab for transmission rates by zip code. We have not been even discussing on doing this by school district, because the geocoding is it's kind of a lot, and we need this to be shared with more people. But the other ones are only done for the school district. This one is for everybody. So here you can see how the transmission by school district, and here you will have substantial, high, whatever it is. The color code is here. And well, I think I said on that last meeting that it was so nice to see this all in blue around May to June, but now we're actually seeing red codes again. And to not be confused about this, Daniel is working on doing this report for you. Sadly, it is 2 weeks behind when we send it, or at least 1 week behind when we send it. And this is because the information from ADHS, we receive it every 2 weeks. So so it's 2 weeks delayed. So, but this could help you in checking the transmission rate. It's going to be a good thing following the new recommendations from CDC. And we have here the dark red, and we can see that there are 3 districts in dark red, at least on the percentage of positivity. So we hope that this is going to be a good guidance. This is a joint effort. It's our data analyst is working on this. Both epidemiologists, most of you, if you don't talk with me, you talk with Joel. So you know that we are all hands on deck here trying to help the schools. Let's talk about the variants of concern. The last time that we talked, I have this slide from July 16. And at that point, the Delta variants that had been genotyped in Arizona, this is all Arizona, not only Pinal, was only 321 samples from 27,902. Now, you see, yesterday when I review, we have like 3,000 more samples genotyped, but our the amount of Delta variant went up to 1,244. So this is kind of the problem with the Delta variant that we were talking last week. And just as a reminder, there is no shorter quarantine if the outbreak is from a variant of concern. The bad thing is that we will not know from everybody. Not everybody is genotyped. Please, please be aware of that. We try to genotype the most people that we know, especially the breakthrough cases, but the genotypification, it's mainly done by LabCorp, and they send it to CDC, so it takes like 3 weeks. Sonora Quest is not doing it unless we ask for the sample when we know that they have it. And the state lab is doing almost everything. Sonora Quest forward to TGen sometimes, and they are the ones that do the most typification, and the other one is the ASU. So it all depends on where the person tested and how fast we know that they tested to be able to ask for genotypification. So don't really wait for this information to do something. We need to do everything as a common outbreak. So last time, also this is 7/26, that was the last time that I checked on this. We had here the Delta variant in light blue, and at that point was around 75% of the cases, all in Arizona. And it was very difficult to see the branch here. So they changed it for purple. And now you can see how they are getting kind of clustered and over. And as of yesterday, all cases in Arizona, or all samples genotype in Arizona was 84.18%. So we're still growing in this, and the alpha is going down, and the gamma is going down. So Delta is definitely taking over our samples. And this is the last time that we talk about the percentage of vaccination. So just a reminder, our goal is supposed to be 70%. And here we have that in Pinal, at least 43.3% of the population had been vaccinated. And see, the school age is where we look at less than 20%, and it was 11.4 in July 27. So then you can check that every school age group has been going higher and higher, when the 65 plus are the only ones that really reach the goal of 70%. Now I checked this yesterday, and at least we are in 45%. So there is a slow increase of people getting vaccinated from a previous 43.3, and in the school age, we have 12.9 from a previous 11.4. So these are good news. Steady, piano piano, va lontano. That's what the Italian said. So what about the vaccine breakthrough cases? As I said yesterday, we were talking about what information will be helpful for you. And this is a graph of our vaccine breakthrough cases. And you can see as the cases goes up, the vaccine breakthrough cases are going up too. So this depends on the vaccine type, but we can have between 5 and 25% of expected breakthrough cases from confirmed cases. So that means that an increase in cases will mean more vaccinated people could be a breakthrough case. And because of that, and because of the Delta variant is more contagious, all these changes have been happening with CDC directions. So it's not like somebody one day woke up and said, okay, from today, I think everybody should use a mask. This is a scientific evidence that we need to take care or take on our decisions. So I have exactly the same slides that have been corrected for you to check the changes, because if you remember last meeting, when I was talking, they were changing the websites, and it was funny because I the day that they change, I print it, I review, and the next day they change it again, and whatever I printed, it was not there. And that's how we're living. So the first thing, so now we're up to August 5th. So this is up to August 5th. So the first thing is absolutely the same. Safely returning to in-person instruction is a priority. But I'm highlighting some words here because we are supposed to do safely returning. And for safely returning, we need to do a lot of things. So vaccination, CDC still says that is the leading public health prevention strategy to end the COVID-19 pandemic. So we used to have this, and that changed. We go now to universal indoor masking regardless of vaccine status. Students, teachers, staff, and visits due to the Delta variant circulation. This is the biggest change. We moved from the ones that are not fully vaccinated to everybody. And this is the most important thing to do at schools. So that's one change. We went to the universal indoor masking for everybody. Then what else? When we review at least 3 feet physical distance between students within classroom to reduce transmission risks, there is a portion that says the kids should not be excluded to be in person if the facility don't have the space to do the 3 feet physical, but you must do layer multiple prevention strategies. And here again is where the masks are going to be super important. And there is a new portion that says between the students, when they are seated, they can be 3 feet apart, but it needs to be 6 feet between teachers and students and between any staff. And one of the things that we saw a lot last year were teachers, and we are all guilty of it, eating together too close or in a small room. That is going to be super important this year because when we eat, we can't use a mask. So all of that things that combine, that's out. The other super important thing is that the schools always have a policy. If you are sick, you can't come to school. If you have any signs of any infectious diseases, and we have people saying, well, they have a fever, when they test negative, can they come back? Well, here COVID has nothing to do with it. You go to your previous thing. If the person has a fever, they need to be 24 hours without a fever before coming back to school. And then, well, if it is COVID negative, you will need to evaluate other things. And we will talk about that later. So the important thing is having layers of prevention to keep schools safe. And we discussed this, screening, testing, ventilation, hand washing. And this is the most important thing that CDC is promoting now. Well, beside the respiratory etiquette, now it's not only using masks, it's consistent and correct use of masks. Masks here, mask as a beard, those are not correct. The correct are covering your nose and mouth and being kind of not super tight, but tight there, so nothing will escape, and consistent. If the whole classroom is not using the masks, then those kids are going to be exposed. Or if the teacher is not using the mask, they are exposing the classroom because they are 45 minutes in that classroom altogether. Stay home when sick and get tested, contact tracing, quarantine and isolation, and cleaning and disinfecting. So all those are the layers of preventions to keep schools safe. And the school with children under age for vaccine, they are still emphasizing the layered prevention strategies and the cohort system if possible. Almost all the elementary schools had been really good in cohorting 3rd grade down, first, second, third. The rest are difficult because of the way that we teach, the 4th, 5th, and 6th grade are teach. but at least the first three, it's really good. The other thing that CDC keeps saying is please monitor the indicators, the community transmission, the vaccination coverage, the screening testing, and the outbreaks. So you know now where to look for those things in our dashboard or in ADHS dashboard. So yesterday we thought that the biggest benefit will be having concepts review today, because we know that we have many new people coming in and it's never a bad thing to review. So the first thing is that the outbreaks, as a school administrator, you are required to report the infectious disease outbreak to your local health department. And that is what we're actually doing. When you call and say, hey, you know what, I'm worried because I have 3, 4, 5 kids. So these are the Arizona code articles that said you need to do it. The definition of an outbreak for the Arizona code, meaning when you see this, you need to let us know, is unexpected increase in incidence of a disease, infestation, or sign and symptoms or of illness. And this covers kind of everything. The incidence of a disease is when you kind of receive the COVID positive in this case. The infestation, think about lice. When you see one kid with lice, this typical school, then you see another one, then you see the third one. Okay, well, this is not normal. And the signs and symptoms is usually when you have kids vomiting or with diarrhea, and it's 1, 2, 3, and suddenly the nurse office is full of kids vomiting. That's for you is the time to report to us. And for COVID specific, we have a suspected outbreak, and this is the time where you go in the suspected outbreak definition. 2 or more individuals report COVID symptoms within 14 days with suspected transmission at the facility. The typical thing will be I have a kid that was positive, and then I had a teacher that 3 or 4 days comes positive, or I have a kid and then the one that was named as close contact, one of those came positive. So that's when we suspect transmission at the facility. The other thing is multiple individuals are out sick above what is usual or expected for the facility without any clear transmission link. So you can have one kid in every classroom, or 2 or 3 per classroom, and we really don't know where it was. But we have discovered, for example, that these kids, especially in high school, then we discovered during the investigation that they were participant in football activity, and half were playing and the other half were at the stadium cheering for them. So your responsibility goes in the suspected outbreak. And if you want to review this, that's the website where you're going to find the information. So, and we will also PDF and send you this presentation so you have this reference too. Other thing super important, what is a case? A case is an individual with a positive PCR or antigen test for COVID virus. So if somebody comes with a positive test that is PCR or antigen, they are a case. It doesn't matter what they say. I think it's a false negative. No, they are a case for you, and you need to tell us. We will determine if it is a false positive or not. You tell us. A confirmed case is PCR. A probable case is an antigen test. But we will determine if you have a probable EpiLink case. And that means that we will count people that are symptomatic with a known exposure, even with a negative test. And here we go in your contact list. When you send us a contact list and somebody on that list gets symptomatic, so we have the known exposure because you determined that they were a close contact. We have symptoms, and they go to the doctor and they test for COVID, or they don't go to the doctor and test for COVID and it's negative, we will still consider them probable, and we will still ask them to isolate for 10 days. That's something that has been a little bit confusing. A confirmed or probable case should isolate for the 10 complete days. So a case needs to isolate. Isolation is only for a positive case for 10 complete days. That has not changed. Okay. Since the last exposure, if they are symptomatic, and since the date of testing, if they are asymptomatic. I think I have a mistake here. Since the date that they began the symptoms. So, because too many people have symptoms, then they think that it's allergies, and 3 days later, with their allergies treatment, they think it's not going, or they have fever, what is not common with allergies, and then they decide to test. That means that 2 days later, they receive the 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 positive result. They began 5 days ago, so they only need to isolate for 5 more days. Um, so one important thing is the vaccine will not interfere with PCR or antigen test result. And yes, Mr. Lazar, we're going to the probable case. The probable is only, it says here, probable case if the test was antigen, and probable can also be epi-linked. But we will repeat it, don't worry. So the most important thing that I wanted clear is that when persons are vaccinated, the PCR or the antigen test result will not be altered because they are vaccinated. It's only the serology. But these, if they have a positive, they are a case, and they are a breakthrough case. So what should you do with a case? Please send them home to complete isolation. You can calculate it, or we will calculate it when you report it to us and we contact them. Make the list of contacts and report to us. And the way that you report to us is in our website. You can ask for the send to aids@pinal.gov, an email asking for a secure link. But please, please, please don't send any information by email. Everything is in our website. Now, what happened after? You need to decide if somebody is a contact. So the definition of a close contact still has not changed. It's a person who has been in contact with the case for more than 15 minutes and within 6 feet of distance. And this is what we ask you to do, to check where they attend classes, where they have a lunch. But there are some things to consider. We have been talking with parents that said, well, the schools are not quarantining the siblings. So you really, really need to consider the relatives living together. If you have one case in 6th grade and this case have siblings in 3rd grade and in 1st grade, those siblings need to go home and quarantine. They can't be going to school because they could turn positive. So we're waiting for them to know if they got sick or not. And this is very important. And we have had people calling saying that the siblings are not being quarantined. So they need to be quarantined. The other thing that you need to consider is the crowded outdoor situations, because outdoor, we are not, so we are authorized to not use masks. But if you have outdoor lunch and you have kids side by side, not 3 feet separated, then you will need to consider that this kid that was positive, even being outdoor, the two that were on the side are a close contact. So that's super important. And the other thing is the indoor situations without consistent and correct use of masks. If you can actually be sure that your teachers and your classes have the correct use of mask and all the time, great. But if you even have 1 or 2 kids that are not using masks and they have been 45 minutes inside, even if they are inside a classroom, even if they are a little bit far away, you will need to consider that, because then comes in the ventilation, the cleaning, the movement inside the room. So when you do your list of contacts, please consider all of this. So all of this, it's independently now of vaccine status because of the Delta variant. So what should you do with a contact? The first thing, establish how close they were, less than 6 feet, more than 6 feet, Were they using mask? They really wear with mask all the time, or without? And I write it this morning, sorry, because I have a mistake there, a grammar mistake there. And the vaccine status, if they are vaccinated or unvaccinated. This is the information that you need to consider if they're going to be a contact, if they're going to be a close contact or not. So if the person doesn't want to tell you their vaccine status, you need to assume they're not vaccinated. And you need to proceed as non-vaccinated. Report them as non-vaccinated and everything. As soon as you report them, we can check. When we receive the report in MedSys, MedSys will give us the information about vaccines. But if they don't want to tell you, please assume that they are not vaccinated. So here, the complicated thing is that you're going to do different things if the person is vaccinated or if the person is not vaccinated. So we're trying to make an algorithm, because I did it by hand, but I need to make it more nice to share with you. But you first will do no vaccine status. So what is the first thing to do? Inform the contact status. Tell this person, well, you were exposed, and check for symptoms. That is the second most important step. First vaccinated, then check for symptoms. If they have symptoms, this person should go and test now. Before we were, maybe not. Now, this person should go and test and should isolate while they're waiting for results. And this is going to be independently, again, of vaccinated status, because we know that some people can get sick even vaccinated. So if there is no symptoms, then they can stay at school or working only if two things: no symptoms are present and correct and consistent use of mask for 14 days after exposure. They are supposed to be using the masks. Now, with the schools, we assume that everybody's using masks because that's the universal indoor masking. But this is really important. And if somebody develops symptoms, we go back to the first place. So they have symptoms, they need to go, they need to test, they need to isolate until they have the results. Now, the new thing that CDC added, this is the new recommendation. You're going to read it in the website. Test 3 to 5 days after exposure. For what we have seen, we will recommend test 5 days after exposure on the person that has been vaccinated. And they can keep working with a mask while waiting for results. This is when they are asymptomatic. And the CDC website says they can stop using a mask after a negative result. But we add outside school because we're assuming that inside the school, there is universal masking. So the recommendation is, okay, outside the school. And this was done because a lot of people with that when you get your infected, we have discussed this, 2 days before is when you're actually sharing the infection. If you assume that you are vaccinated and you assume that you're okay, then you could be sharing with people that you don't want to share. At school, of course, with the kids, but what if you have kids at home that cannot be vaccinated? What if you have an immunocompromised person at home? So that's why this new recommendation came in. Before, up to last week, 2 weeks ago, it was, well, if you want, you can do it. Now it's really recommended to do it, to send somebody that is a vaccinated contact to test if they don't have symptoms, just in case, to detect an infection ahead, like fast. Now the thing changed with unvaccinated contacts, but the first thing is the same. Inform the contact status and check for symptoms. And we will do the same thing. If symptoms are present, this person should test and isolate while waiting for results. That's same thing in any contact. Now, unvaccinated contact should quarantine for 14 days. 14 days is still the gold standard for quarantine. what is has happening is that quarantine can be shortened if no symptoms are present, but no symptoms. So if somebody is quarantining and here comes day 3 and they have symptoms, we go back to the first thing. They have symptoms. Now they could be a case they need to test. Okay. So one option is, if you want to shorter quarantine, is test at day 6. If the result is negative and there are still no symptoms, then they can come back at day 8. So when we said you can shorten the quarantine at day 7, that means that the person comes back at day 8, not on day 7. And then the other option is that no symptoms for 10 days, then you don't need test and the person can come back at day 11. But everybody should continue correct and consistent use of mask until completing 14 days of quarantine. We have seen cases becoming, contacts becoming positive on day 12, 13, and 14. And I know that some of you have had the experience. So that's why you need to complete the use of masks. And as I said, now the thing is correct and consistent. Okay, I think that was a lot of information. So I'm gonna stop sharing my screen and we will go to the questions.
Thanks, Mariana.
Okay, no, this one, no, this one, you're presenting. I'm trying to present. Stop presenting. There we go, Jan.
There we go. So in our questions, in our chat box, we have a question from Debbie Tabling about if someone tests positive, are they told what variant they have?
Okay. No, we will not tell them which variant they have. And there are 2 reasons for that. First of all, as I said, not everybody will know which variant they have because not everybody is genotyped. And the second thing is usually we know very late. It takes like 3 weeks or more for us to get the results. So they're going to be out of quarantine. And the third reason maybe is that CDC is requesting not to tell people because if there is a really bad outcome, it could be a really heavy mental health issue, knowing that you had the Delta variant, gave it to your grandmother and she died. So that's only an example, but that's why they said they are recommending health department not to report, and that's the guidance from ADHS.
Great. So the next question was for the definition of a probable cause.
The probable case will
sorry.
be no problem. A case will be probable on epidemiological definition if they have an antigen positive. But for you, it's a case is a case. Being positive PCR or positive antigen, it doesn't make a difference on what you do. You just treat them both the same and go into, are they vaccinated or not? Do they have symptoms or not? So, and the other one that could be probable is somebody that doesn't want to test but has symptoms and has the known a known exposure, or even test and they are negative. But if the known exposure is really a close contact, and we have this at the beginning of the pandemic, knowing that there was tests, the test was in a short supply. Some people was like, okay, my wife is positive and now I have symptoms. I will assume I don't want to test because I know that this is this, and you can test another person. Those generous people gave us the probable definition and the possibility to test more people.
Mariana, can you explain or define the difference between an antigen test and a PCR test for those that are new?
Yeah, so both will detect proteins. You should have, let's begin from the beginning. If you have seen the virus everybody has seen a photo of the virus or a description of the virus. It's a round thing like a ball with spikes, like the flu virus. All those spikes are proteins, and these antigens and PCR detects these proteins. Now, antigen only detects the proteins around these things around the ball. The PCR detects actually the genetic material, the RNA, and that's why it's a little bit more specific. And that's also why we consider that one, okay, this is real. We have a cell. It's like detecting DNA in a crime. That's a PCR. And detecting the protein only, that is the antigen, is like finding the digital prints in the crime scene. We don't see the guy, but we know that he was there because of the digital prints. So that's the difference between both. For clinical reason and case management reason, they are both considered a positive case and they should be isolating and everything.
So,
Okay, so we have questions about mask use in schools, and we know that the reality is that it's difficult to require masks in schools. However, it's different in an outbreak situation, isn't it?
I'm reading what you said, so I will say we need to be very clear that we do recommendations. We need to recommend we follow CDC recommendations, because here says, you said that schools should be requiring mask in classroom. So we're recommending universal use of masks. It's a different thing. We cannot require because we cannot enforce it. And that comes to the next question, the consistent use of masks. When the governor has a law that says that we can mandate. So we have this discussion with our legal team, and that law will not be in effect until September 26th. So for now, you should be okay. And all the rest of the things, you should actually, on that specific situation about the laws, you need to ask your legal team how you are going to go through the anti-masker or anything. And that's where you go, you know your specific situation, you know, then you know who is going to be a contact or not. We can only tell you this is what CDC recommends and we're following it. Then it says, in a case like this, would you recommend that the individual complete the full recommended number of days of isolation quarantine? If somebody don't use a mask, yeah, they need to be 14 days out. They can come back only in a shorter quarantine if they have everything and they commit to use the mask up to day 14. Will there or are there opportunities provided by Pinal County to get vaccinated? Corey, you are the expert on that side. It says get vaccinated, and can you share what you know or companies to partner with? I think they are referring to the ADHS or pop-up clinics.
just tell them.
So, do you want to answer that one?
Yeah, I know Jan has sent the link out, if you want to request a pop-up event at your facility. And that is through ADHS, and they will work with you, and look at all of the particulars, and will work with you to set up an event. We do have other opportunities in the future to set up community events, but we're leaving the ADHS capability on linking their resources to your site to get these types of vaccination events at your site. So look at that link, and you would fill out all the information, and then ADHS contacts you. a couple of things about that, and I know Jan knows that survey very well. They want to know if you can possibly give them a couple of weeks of notice, and if you have any idea how many that you think would be requesting vaccination. And this would be for 12 years and up. Predominantly, that would be Pfizer. Because that's the only vaccine approved for 12 years and up. And Jen, do you have anything else on this survey that they would need to know?
No, I just would encourage districts that are located close to other districts to kind of work with them, because you're more likely to get approval if you can have a lot of folks showing up, right? So if you have a neighboring district and you can kind of work together, that might be a better way to submit together. All right, so thank you, Joel, for answering
Yes.
the question.
It looks like I was confused. I confused people a little bit, and Joel already answered the question. But I want to say something that we said from the beginning. You don't need to quarantine an exposure of an exposure. What we do is quarantine the exposure to a contact. So Mr. Lazar here says if the student X is positive, then the close contact will be Y and Z. So those two needs to quarantine, student Y and student Z. When they become a case, that's when you quarantine the student, the siblings, not before that. So only as Joel already says, only the case that has two siblings, those two siblings need to quarantine because they were in close contact. The other are the student. If the other student, the Y and the Z, become a case, become symptomatic and become positive, that's when you quarantine the rest of the family and keep quarantining the close contact that were with them depending on when they come positive. Sometimes we have this next day. Sometimes, most of the times, even though we don't recommend it, as soon as you said that somebody was exposed, the parents take them and go to test. And most of the time, it's probable that they will get them positive. There has been a problem with some of the school districts are sending the quarantine letter that we provide. And by the way, we're working to change that letter, but they're also providing a low exposure letter. And that low exposure sometimes makes people go and test the kids and they test positive. Oh,
Great.
there are
If
more
anyone
things.
else has, yeah, thank you, Mariana. I know this is ridiculously confusing right now, and it gets more so every day on our end as well as on yours. So we're working on some algorithms that might help us to, we can share those with you, and that might help to clarify some things. In the meantime, if you have questions during this call, please feel free to put them in the chat box or take yourself off mute and ask.
And I would like to say, Mr. Duplessis, I don't know if I signed it correctly, but we really, really appreciate the school district that are doing the right thing in reporting, because we know that not everybody have been doing it. And all that you that are here are helping, besides helping your schools and your kids, you're helping us too. We have a lot of cases reported in the community, and the way to work with the schools that are really doing the right thing in reporting and enforce, it's a huge help. So thank you, Mr. Duplessis. I hope I said it correctly, because he said that they are doing the right thing. Yes, we know who are reporting and who is not reporting, because we receive reports for 100, 150 schools, and we have more than that number of schools in the county. So no more questions. Yes. when generating a close contact list, do we list individuals that are vaccinated? Yes, please list the individuals that are vaccinated, because you never know when somebody's going to be a breakthrough. You can list or make an asterisk or said these are the vaccinated. So that's a good question for us to ask ADHS, because I'm not sure we will report to them, but we will be on the look for them if they become cases at some point. Joel, something to remember, please. Okay. I don't know if there is anything else, Joel, that you remember, or Daniel that remember that I haven't said that will be important to share.
We don't know for sure, but
Yeah, it's-
All right, well, I want to thank everybody for joining us today. We have recorded this call, so we'll send you the link and the slides as well this afternoon. You know where to find us. Please do not hesitate to contact us.
There's one more question.
Oh, good.
Oh, there's one. I tried calling several numbers yesterday for some direction on case reporting with no luck. Okay, the number that we have in the website is the 520-866-7281. That number is directed to our administrative assistant that we actually don't have anymore, but that number is forwarded to one of our CDI assistants. So you should receive information. But when you don't have, please leave us messages. We are running all the way around. We have calls. So leave us a message or send us an email. Please call us. The other thing is calling the number, the CAD number, our contact number for the Pinal County Health Department, and the ladies there will transfer you, or will take a message and send us an email saying, hey, this person called, because sometimes everybody calls at the same time. So please leave a message, send an email, and but let us know. Don't try to call and not leave a message. We will call back.
Jen's going to be putting some information up right now as well, as the email address. So IDES is the infectious diseases epi surveillance. So the email will go directly to IDES. And then we have the best number to call. And then, of course, Jen will also put up the number. If you can't get through to 7281, please let us know. It's really important that we know if you're not getting through to that number. And you can let the central appointment desk know, and Jen will be putting that phone number up as well. Thanks.
Yeah, and these two numbers at least are the same ones that you're going to report, and that's in our website if you, for any reason, you forget. And it's also at the, I think I have it at the end of the presentation. I have my email. So some people keep emailing me, and I will forward it to the person that needs to send you the number. Some other thing that happens is that we are doing case investigations, and that can take 30 minutes. So that's why we need you to leave a message if you can't reach. And if not, go on to our website. We are in the coronavirus website. There is a school section specific with all the information of how to report. Okay. And we did it in 1 hour, Jen.
Thank you everyone so much for your time and your patience and all the work that you do every day on behalf of students. We really appreciate it. We'll be sending out this information this afternoon. Thank you.
Bye.